This video is aimed to patients that are going to undergo a prostatectomy procedure and is part of Ashford and St. Peter's Trust. We will talk you through some important advice to help you prepare and recover from your surgery. We are going to explain what you can start doing from now on to prepare for your surgery, including some anatomy and pelvic floor exercises, what happens after the surgery, and how to manage your bladder, bowel, and sexual function. We will now talk through what you can be doing whilst waiting for the operation to help strengthen the muscles that control when you urinate. By starting this now, the muscles will be more supportive and might help you recover more quickly from any urinary problems after the operation. Pelvis is a bone structure that supports the spinal column, separates the upper and lower body, and protects the pelvic organs. The pelvic organs represented here in the side view, starting from the right, are the rectum and anus, the bladder and urethra, the prostate, and the seminal vesicles. The penis and testicles are external organs. The rectum is the last section of your bowel, and it stores stool before you're ready to pass a bowel movement. The anus is the opening to the rectum. The bladder stores your urine, and urethra is the tube that connects to your bladder, passes the prostate, and runs to the end of your penis to transport urine out of the body. The prostate is a gland that produces the fluids that transport and sustain the sperm, and the seminal vesicles store the fluids produced. The pelvic floor muscles are a set of muscles with superficial and deep layers. They are located in the pelvis, shaped like a bowl or dome, and attached from your coccyx to the pubic bone and into the sitting bones. The pelvic floor muscles support your pelvic organs. They provide extra closure to the urethra and rectum to help with continence of urine and feces. They work along your back, hip, and abdominal muscles to keep you upright and stable as you move. They contribute to sexual satisfaction by helping maintaining the strength and stability of your erections. They trap the blood inside the penis and maintain the pressure throughout an erection. And they also contribute for the sensation and quality of your orgasms. So why are the pelvic floor muscles important, particularly after prostatectomy? You see, the continence of urine is provided by three structures: two sphincters represented here in red, and the pelvic floor muscles. Sphincters are ring-shaped muscles that relax and contract to open and close the urethra. During surgery, the sphincter close to the bladder is removed alongside the prostate and the section of urethra that runs inside the prostate. When this happens, the continence of urine must be maintained by the remaining structures, the pelvic floor and the external sphincter, which must become stronger to accommodate this change. This is why urine incontinence is one of the most common side effects of a prostatectomy. Urine incontinence is a lack of control of urine from coming out. The most common type of incontinence after prostatectomy is stress urinary incontinence, which happens when there is increased intra-abdominal pressure. This can be caused by a cough, sneeze, lifting a heavy object, jump, laugh, etc. And the muscles and sphincters are not strong enough to stay closed around the urethra. There is good evidence that shows that starting pelvic floor exercises before surgery can reduce the level of incontinence or improve the recovery time. We would recommend you starting these exercises straight away and continue doing them after the procedure for around 4 to 6 months. To identify your pelvic floor muscles, imagine you're trying to stop yourself from passing wind and then pull forwards and up to also close the urethra. This might be easier if you imagine trying to lift and bring your testes forward. When you do this, you should feel your muscles lift and squeeze. It is important to breathe normally while you are doing pelvic floor muscle exercises. You might also feel some gentle tightening in your lower abdominal muscles. This is normal. People used to be told to practice their pelvic floor muscle exercises by stopping the flow of urine midstream. But this is no longer recommended, as your bladder function could be affected in the long term. Start practicing these exercises 3 times a day before your surgery. And after your surgery, you can start these as soon as your catheter is being removed and you can pass urine independently. There are 2 ways to exercise these muscles, with long and short squeezes to work different parts of the muscle. For the longer squeezes, tighten your pelvic floor muscles and hold for up to 10 seconds. You should keep breathing normally whilst you hold. Then relax the muscle fully and repeat 10 times. For short squeezes, tighten your pelvic floor muscles tightly for 1 second before relaxing fully and repeating 10 times. If you can't do many to begin with, don't worry. Start with what is comfortable and then gradually increase, aiming for 10 long squeezes up to 10 seconds each, followed by 10 short squeezes. At first, you might find it easier to do them when you're laying down or sitting. As your muscles improve, aim to do your exercises when you're standing up as well. You can also use a preventative squeeze for your pelvic floor muscles before you do anything that might put them under pressure, such as lifting, coughing, or sneezing. This can prevent or reduce a leak. Some people use triggers to remind themselves, such as brushing their teeth, meal times, or advert breaks on television to get into a regular routine. For people that have smartphones, you can download the Squeezy Man app where you can set reminders. Your bowels may take time to return to normal after your operation. You should aim to have soft and easy to pass motions. You may initially need to take laxatives or glycerin suppositories, which will be prescribed to you to avoid straining and constipation. When you empty your bowels, you might find it more comfortable to hold your abdomen or apply slight pressure over the perineum, the area of skin between your scrotum and the back passage. This provides support for the first few times. Straining to empty your bowels can place a lot of pressure on your pelvic floor and impact recovery and long-term outcomes. Try placing a small footstool under your feet when you are sitting on the toilet so that your knees are higher than your bottom. If possible, widen your knees apart, lean forwards and rest your arms on top of your legs. Keep your tummy relaxed. Do not tighten your tummy muscles in. Instead, gently breathe into your tummy, allowing it to widen, and then gently push your stomach outwards, as if pushing against the tight waistband, and imagine your back passage opening. Keep using these techniques and laxatives until you feel comfortable, and if you become constipated at any point, come back to these tips. During surgery, a catheter will be inserted in your urethra. This means you'll have a tube coming out of your penis to drain your urine. This catheter stays for 1 to 2 weeks to allow healing, so you will go home with it. You'll receive an appointment to get the catheter removed in hospital, and a nurse will show you how to take care of your catheter, and you'll be given a separate leaflet with further information about your catheter management. It is important to drink 1.5 to 2 liters of fluid steadily over 24 hours. Make sure that you drink small amounts of fluid at regular intervals throughout the day. Drinking less frequently can make your urine concentrated. This can irritate your bladder and increase your risk of having a urine infection. For the first 6 weeks, aim to limit caffeine, fizzy drinks, and alcohol, as these drinks can also irritate your bladder. Once your catheter has been removed, it is normal to feel you want to pass urine more frequently and have more urgency to do so. This means you might get less warning that you need to empty your bladder and must rush. This should improve within 4 to 6 weeks, but avoiding the drinks mentioned above will also help the process. As we mentioned before, the most common side effects of a prostatectomy is urine incontinence. You might experience leaks up to 4 months post-op and sometimes longer. As soon as your catheter is removed, you should try to restart your pelvic floor exercises. You might feel that they are harder to do or that you feel less of a squeeze or lift, but keep doing them as the sensation and strength will return. If you feel they are uncomfortable to do, start gently with less repetitions and then increase as you feel more comfortable. Aim to do them 3 times a day for at least 4 months. This should help improve your strength and reduce your leaks. If you are struggling to do these exercises and you're not seeing your symptoms improving, ask your consultant or nurse to refer you to the pelvic health physiotherapists. If the symptoms persist after this, there are a few other options that vary from conservative to more invasive procedures. During an erection, there are 3 factors working together: arousal, blood flow, and pelvic floor muscles. When there is mental and sensory stimulation, the brain sends message to the penis via the cavernous nerves. This causes blood to rush in to fill the penis. The erection is then maintained by valves that close and the pelvic floor muscles that tense to trap the blood. During a prostatectomy, the surgeon will try saving as much of the nerves as possible. For those who have partial or full nerve sparing, it can take up to 2 years for erections to return to normal, as nerves take the longest to recover. Unfortunately, the surgeon can't always spare the nerves, and in these cases it's unlikely that the erections will return without medical help, and in some cases they might never return. It is important to get the blood flowing through the penis early on. You can start experimenting when the catheter is being removed. This might include masturbation, massage, stretching exercises, and pelvic floor exercises. Don't be too discouraged if nothing happens initially. This will be discussed at your outpatient's appointment and suggested that you start medications such as Viagra. You might be recommended to use a vacuum pump to help with erectile rehab. You can attempt sexual intercourse when you feel comfortable. You should experience normal sensation during intercourse and be able to climax, but no ejaculation fluid will come out. If you've had both nerves sacrificed, your erections will not return to normal. However, you might be able to gain an erection using a pump, an injection, or pellet given localized to the penis. You'll be able to discuss these options with your consultant, urology practice nurse, or GP. This slide, you can find some useful resources on prostatectomy. You can use the QR code to access these resources. Here you can access the Squeezy app, the Pelvic Health Physiotherapy website, and pelvic floor muscle exercises by scanning the QR codes. Thank you for your time, and if you have further questions, please contact the urology team as they can refer you to the Pelvic Health Physiotherapy for further support on your pelvic floor exercises.